Hello and welcome along to another of the Vita podcast series, and of course video this time. Nice to see you. The idea of the podcast series is of course to give you an idea as to what the staff and the contributors to Vita actually get up to. Today I'm joined by Dr. Katy James. Good to see you, Katy. How are you?
Hi, I'm good, thanks. Very well. And yourself?
I'm good. Now, before we get underway with today's topic, which is a critical incident, perhaps you can tell our viewers what you get up to. What is your role within Vita?
Yeah, certainly. So I am the head of clinical mental health here at Vita for our corporate and private services. So I really support the clinical team in making sure that we're providing really excellent care and therapy and different treatments to our different clients that we have that we work with. So that might be kind of directly supporting the team in terms of their clinical work, but also it's in supporting our customers, thinking about how they can better support their staff groups and make sure that their employees have really excellent support in terms of their mental health. So it's quite a varied role. I really enjoy it here at Vita. It's a really interesting role which involves lots of different things. I've worked in mental health for almost 20 years now, and you know, this is a role that I've really felt uses all of my skills. So it's really enjoyable.
So fair to say you keep very busy then?
It is quite busy, I must admit, yeah.
Okay.
In a good way.
So let's get into the nitty-gritty then and talk about critical incident. What exactly is that, Katy?
Yeah, so it's a great question because it's often a term that's used kind of within kind of workplace settings, and it doesn't really necessarily say what it is on the tin. But what we mean by a critical incident is essentially is an unexpected event that happens in the workplace, normally impacting a number of people, although it might not necessarily impact more than one. And it's normally something that's quite traumatic or has an element of threat to life. So this could be an industrial accident, for example. It could be a fire. It could be perhaps a robbery that takes place in a workplace, something that nature. So it's not a pleasant incident that happens, obviously, completely out of the blue. People wouldn't be expecting it in the workplace, and obviously can really have quite an impact. There are sort of other things, Glenn, I just wanted to mention that don't necessarily come under this formal term of critical incident, but other things that can impact employees in the workplace in a similar sort of way. So things like the death of a colleague, for example, that can have a big impact on a team. That the kind of services and things that we provide for critical incidents can also be really useful for. So we kind of include those things often under our umbrella of critical incidents. So really anything that is impacting those employees in the workplace is something that we can provide support for.
So that impact then, Katy, on those people can be very traumatic, as you say, can't it?
Yeah, absolutely. So, I mean, obviously, these are unexpected events that happen. We're just doing our normal job day to day, and something out of the blue happens that actually makes us feel like and could be an actual or perceived threat to our existence, to our very life. So, obviously, psychologically, this can have quite an impact, understandably. Our brain is built to protect ourselves, to essentially keep ourselves alive. So when something like this happens, both our brain and our body is undergoing lots of different physiological changes to ensure that we're safe. So we will often experience, a whole range of different physical, psychological experiences, both during a traumatic event like that, but also in the time, minutes, hours, days after that sort of event. This is nothing to worry about in the sense that this is just our brain and our body looking after ourselves. It's essentially been in a situation where it feels like there's a real threat here, and there may well have been real threat here. So it's doing all of the things it needs to do in order to protect us. But this can feel quite worrying for us as an individual, because obviously it's not something we've potentially experienced before. So this is something that it's really important that we support people with. So some of the things that people might experience.
And I guess in a way, this must be where somebody like yourself steps in, Katy, at Vita. I mean, what can you do to help people in such incidents?
we can offer help in all sorts of different ways. So depending on the type of incident and what's happened, and indeed the team themselves, will tailor the kind of support that we can provide to the needs of that particular team. So often when we have a traumatic experience happen to a team, individuals will react to that in all sorts of different ways. So some people may feel quite a lot of anxiety symptoms, feel quite hyper aware of danger, so they can feel in quite a high state of anxiety for quite some time, and it can disrupt their sleep, their appetite, and their desire to kind of want to go out and do things. So all of those kind of experiences and symptoms, as I say, are completely normal, but are things that we can support with. So what that might look like is it could be one of our clinical teams, so one of our qualified counsellors, going out to a workplace to actually spend time in that workplace, available for staff to go and see. We do normally say that we encourage this on an individual level initially. Often there's a desire to kind of bring teams together when some of these kind of events happen, and that can be a really useful thing to do. But initially, those kind of individual moments for people to be able to go and speak to someone that's, independent of the workplace, if you like, but is trained and qualified to kind of support people with the kind of different mental health and emotional difficulties, can be really, really supportive for someone in the workplace. And having them right there on site just makes that accessibility much easier than perhaps having to pick up a phone or make an appointment. So that's something that we do provide frequently for our customers.
So, I mean, that incident could have a serious impact not only on the employees that person is working with, but obviously on management, the employer as well. I mean, do you offer support to the employer as well?
Yeah, absolutely. So, we often offer guidance and support for different managers or employers in terms of what to do. And this is a whole kind of range, if you like, things that we can provide. So there's obviously the in the moment assistance. So our customers can call our 24/7 helpline to speak to one of our counsellors at any time. So it could be kind of after an event has happened, just to call through to say, look, this thing has happened to my team. I'm not quite sure what to do, what the best thing is to support them. Can you give me some advice? And our counsellors will provide that advice there and then. What they'll also provide is a follow-up call with one of our specific critical incident support team. So this is a team of clinicians who are the ones that go out to these particular events and support with these events, and can talk through then with someone what the kind of support might look like for that team in the following days. We always suggest that initially kind of trying to get people back to normal and to use their existing support mechanisms is the most important thing. So research tells us that in terms of preventative work, we know that is a really helpful thing to do, that in a way, when we've had something unexpected happen, the best thing is to try and create normalcy. So not try and do lots of different things and ask people to do lots of different things, going to different groups, going to see different people, all of that kind of thing. So initially, just really supporting staff in getting back to normal, speaking to friends and family, kind of giving themselves some time, some care time to look after themselves, but really just getting back into a routine. So we can provide all of that advice to that employer or that manager.
You've got to be pretty adaptable, haven't you? Because every case is obviously very different, and some not so serious as others. But you've got to go in cold and pretty well assess the situation straight away, haven't you?
Yeah, so you're absolutely right. Every situation is different, and it's although a kind of really challenging area to work in. Obviously, these are not events that are pleasant for people. What's really satisfying for our team is that we can go in and provide that support to our customers at the time that they need it, and provide the advice that we can over 30 years of working. Vita's been working in this area for over 30 years, so we've got a lot of experience across the company in terms of what the best thing is to do for that employer. And different teams are different. I think that's why it's always very important to us to speak to that direct manager of that team if we possibly can, and find out about how does that team function. Some teams are kind of very a bit like a family, and actually that will impact them as if they were kind of a family, and actually working together with that team can be important. Other teams are very big and people don't know each other so well, so actually it's much more important to approach that in a slightly different way, and kind of trying to bring those people together when they don't really normally get together is not really the best idea. So there's lots of different ways of approaching it, and that kind of understanding of the team and the customer and employer is really at the heart of what we do.
I mean, you're obviously supplying the expert advice, but you're also, in a way, supplying emotional support as well, aren't you?
Yeah, absolutely. So that's very much the bread and butter of what we do within our employee assistance program, and our helpline, 24/7 helpline, is emotional support whenever people need it. And in a critical instant, that's a time where people really, really need to reach out for that. Obviously, our helpline is still there, and for a lot of people, that's actually something that they will use, and some people will prefer to do that than actually sometimes we have a clinician in the workplace, and actually only a few people will make use of that. It kind of depends on, as I say, on the team. Other people prefer to kind of be in the comfort of their own home and make a call to us, on our helpline that way. And that's absolutely fine as well. That's what we're there for. But absolutely, that emotional support is a key part of what we're offering. And in addition to that, being able to screen for kind of potentially more significant symptoms that might be emerging. So as I mentioned, it's completely normal to have all of these kind of not very nice symptoms, but they're normal symptoms or experiences after a critical incident. But if we can find that this is going on for more time, or actually these are having a more significant impact on someone's life, this can sometimes happen if someone's had trauma happen to them previously in their life, and things can kind of almost be re-triggered by something else that happened. Again, our clinicians are very skilled at being able to identify, actually there's something here that's a bit different, we might need to think about perhaps a different approach, or indeed a referral into other mental health services.
Okay, well, it's obviously something you're very good at. You specialise. This is your area of speciality, critical incidents. Katy, it's fascinating. Thank you so much for joining us today on the video podcast. If anybody wants more detail and how perhaps you can help with critical incident, what's the best route?
Well, there'll be some information that appears on the screen magically. I believe the magic of technology. So we've got a QR code and a website, so you can find out more about the services that we offer and get in touch with us if it's something that you feel would be helpful for you. I just mention also at this point that obviously helping it after a critical incident is something that we do all the time. But also we offer a range of kind of preventative workshops and things. And I say preventative not because we can prevent a critical incident, but we can provide support to managers and to staff to help them kind of be in a position where actually the impact of that kind of incident is going to be much less. So, really good mental health support in the workplace. We do mental health first aid, for example, which is a fantastic course both for managers and employees to be able to kind of understand mental health and emotional difficulties, so that actually the workplace can be a place where people feel well, both physically and mentally, which is a much better way of allowing people to respond to these kind of incidents longer term.
Okay, excellent. Lots on the Vita Health Group website as well, so do check that out. But Dr. Katy James, I'm guessing we've just touched on the subject, really. I mean, there's a lot more we could talk about, maybe in a future podcast. But thank you so much for joining us today. Great to talk to you.
Thanks very much.